Hi guys, how are you? Welcome back to my channel and thank you so much for being here. This is a video that many people have been asking me for, so I'm gonna go ahead and give you guys an update after 1 year in the ICU as a new grad. So let's go ahead and get right into it. It's been one long, hectic and crazy year as a new grad in the ICU. I have learned so much, I've grown so much tremendously, and starting as a new grad, not even in the ICU, just starting as a new grad in general, I always thought to myself, when and how am I gonna get to become that nurse that knows how to critically think, knows when a patient is crashing, knows what to do when a patient is crashing, knows how to decide which patient to go see first, like all of those questions that they ask you in the NCLEX and all your tests, like which patient are you going to go evaluate first. And I always wondered, like, how does one become that nurse? And the answer is through time. So it's been 1 year. I work in a trauma burn ICU unit, but I also, now that this year we had COVID, I also did take care of many very sick COVID patients for a very long time. I've also taken care of neuro patients. I take care of medical surgical ICU patients. The only thing I don't really take care of is any cardiac patients. So I have seen a lot of different things, been exposed to a lot of different types of things, and taking care of very sick critical patients, and also just confused hip fracture patients. So in my unit, what we mostly see are any trauma patients. A trauma can be something as simple as a ground level fall that someone broke their hip, or a ground level fall that someone has AFib, is taking Eliquis, now has a huge subdural hematoma. They did a craniectomy, and they have an EVD, a Camino, there's so many things. So I can take care of somebody that isn't so critical, and I can honestly say with everything that I've seen in my unit, I work in a level 1 trauma center, and the difficult patients that we get, I can take care of the easiest patient on the unit, and I can probably take care of the hardest patient on the unit, even after 1 year being in the ICU. We also do see burn patients. We take, again, level 1 trauma center, so we can take any 2nd degree to 3rd degree, full thickness electrical burns, chemical burns, any sort of type of burns. And burn patients are there for many months. So that's something that's very rewarding, because you see them at their worst, and then you see them when they go home or they get transferred out to a rehab facility. And that is probably the scariest to look at, but not the most difficult patient. With time, all those patients need is just so many surgeries, sometimes more than 15 surgeries, and just a lot of wound care. That's very physically demanding, because we have to do wound care on them sometimes twice a shift, or maybe once a shift, and we have to be completely gowned up, hair picked up, hair covered, gowned up, double gloved. And it's a very, depending on the type of burn, can be as long as a 2-hour dressing change, and it's very physically draining and physically demanding. I would say the critical trauma patients are a little bit more mentally draining, also physically because you're running around, but very mentally draining, just because you have a patient that's crashing on you, and you need to know why they're crashing and how to fix it, or when to call for help, or when to call to a doctor, and what order to ask for. So that was just a quick sum up. So now that we're going to go in specifics, after a year, when it comes to speaking to doctors, that was one thing that as a new grad I was extremely scared of. When it comes to speaking to doctors, if you work in the same floor, as time goes by, you're gonna start seeing the same doctors. It's not like doctors are coming in and out. It's probably basically the same cardiologist and neurologist. There's 2 neurosurgeons, and then we have the trauma team with other residents, and then we have the burn physician, the plastics physician. So you pretty much see the same physicians, the same RNPs, the same PAs. So you start to build a relationship with these people on a professional level, to the point where you respect them as a professional, and vice versa. As long as they see that you can critically think and you have a good head on your shoulders, which comes with time, then they will. When you have a patient that's crashing and you give them, you basically use your S-bar and you give them a recommendation, 8 out of 10 they will take your recommendation and say, let's try it out and let's see what happens. So speaking to doctors, getting orders, or notifying a doctor when something is wrong, it gets easier as you work with the same doctors over and over, and just with time you're gonna know what to say, what not to say. When it comes to, for example, in the ICU, managing different drips and different medications. So pretty much the doctor will put the order in, and us as nurses, we have a guide. So Levophed, we're going to titrate by 2 every so minutes. Vasopressin, same thing. When it comes to sedation, you're going to start to... the more patients that you get on a Levophed, vasopressin, epinephrine drip, the more that you're going to learn. So you're going to know more for your next patient than you did for your previous patient. And that's, again, is going to come with time. If you have a question about any drip, you can also I know my facility, they have like clinical pharmacology, where you can look up a medication and see how it is that you're supposed to titrate it. If you have any questions, call the pharmacy. If anything, call the doctors, and anybody, you're taking care of a human life, so anybody, if you're asking the right way, anybody's going to help you. Other nurses, other experienced nurses, or just anybody around you. When it comes to titrating drips, there is an order that you have to follow, but every patient reacts differently. You have neuro patients that they want their systolic blood pressure between a certain amount, or sometimes spinal cord injuries, they want their blood pressure between a certain amount, or maybe they had a hemorrhagic stroke and they want their blood pressure below a certain amount. They're always going to give you parameters, and you're going to titrate according to those parameters. Of course, every single patient is different, so every patient is going to react to the titration in a different way. When it comes to just critically thinking has gotten so much easier, and it's just time. It's really hard when they give you a very critical patient. I've taken care of extremely critical patient. I've taken care of trauma patients that have been in very bad accidents. I recently took care of a self-inflicted gunshot wound that became a patient that ended up donating his organs. The family decided to donate his organs, and that in itself is extremely very interesting case to follow, because there's certain drips, electrolytes, and a lot of things that you have to follow that you wouldn't follow for a regular trauma patient. So that was very very interesting. I took care of a really young electrical burn. Unfortunately, ended up passing away. But just with every single patient, and you start seeing different trends, and you start learning different trends. I have a patient, 90 years old, mind you, a DNI patient that actually was a burn patient, and she's at the point where she's just getting rehabilitation and just dressing changing, so she isn't a critical patient. All of a sudden, we turn around and she's blue, saturating 39 with a perfect waveform, and her heart rate is trending downward. What do? She had to trach, we're gonna suction her. So that's just you're gonna learn with time. And it's really important to constantly help your coworkers. When they see that you would go above and beyond for their patients, trust me that they're gonna go above and beyond for your patients. And you just ask. If you say, I need help, like my patient's crashing, I don't know, you need to ask for help. So that's another thing that I have noticed that has really changed. Life as a nurse, especially during this year that was COVID, I think I'm going to make a separate video on its own just for COVID. Let me know in the comment section down below, or let's give this video a lot of likes, and if I see that we have a lot of likes, then I'm going to go ahead and make that video, because being a new grad as a COVID nurse was extremely drastic, very emotionally difficult, very critically. These patients were sick, and many of them did die. That's me moving on to the next subject. When it comes to patients in my unit, in the ICU unit, as a level 1 trauma center, unfortunately, there are a lot of deaths, and it just comes with the job, and it's something that I don't think, it hasn't really gotten easier, and I don't think it will ever get easier. I when I do my job, even though I'm thinking very critically, I do get my emotions involved, which I honestly don't know how to help it. And it is at times, especially when COVID was at its peak, very emotionally draining when I've lost certain patients has been very emotionally impactful and impacted me very bad, to the point where I would lose sleep. I couldn't sleep. I would have bad dreams. So that's extremely difficult, and that just, every single day just going with the mindset that at the end of the day we're not God, and we get very used to playing God, because when we have a patient that's crashing, we can either, if they go into a cardiac arrest, we can code them, bring them back, put them on certain drips, and some of them do walk up and out of the hospital, so you feel in a way that you saved their life. But at the end of the day, wrapping my mind around the fact that when somebody's gonna go, they're gonna go. It's easier said than done, but every single day, every single shift, or every single loss that one of my patients takes, it's just a learning curve for the next patient. When it comes to, so moving on to equipment, every hospital has their different types of pumps, but according to your different hospital, every pump, the pharmacy does set different parameters for different medications. It'll tell you when it's maxed out, when it's minimized, when it's below the minimum. It'll tell you, different concentrations, so that's good. Clinically wise, like hands-on, machines that I work with on a daily basis, arterial lines, that's already like having a BP cuff, Vigileos, we do that a lot for patients that are not hemodynamically stable, which happens a lot with trauma patients that lose a lot of blood and have lots of extensive surgeries. Massimos are also something that we use for trauma patients, just because, of course, they're bleeding. Sometimes we don't know where, and we use that to monitor their hemoglobin. Caminos, since we do have a lot of head strikes, ground level falls, or traumas that unfortunately have to do with the brain, we do use the Caminos to measure like ICPs, and we have different ranges of where we have to keep it in. EVDs, something that we use to drain cerebrospinal fluid, lumbar drains. What are other things that we see on a daily basis? Materials that we use to care for different burn patients. What's another thing? It's so many things that we see, at least that I see on a daily basis, that has taught me so much, and I learned so much with every single patient. It's only been a year. I personally love working in the ICU. I love seeing a disease process go through being the most critical, to being better, now to getting discharged or to being downgraded to the floor. That's what I like about nursing, seeing the disease process, seeing people get better. And it does happen, even though some people are on the brink of death and you think, all right, or some people die, we code them, they bring them back, and guess what, some of them still end up going home. So I would say that part is extremely rewarding, and I love to interact with humans, and just the family interaction and being someone's rock, or educating someone when in their life as a family member they're either losing someone or they're completely lost. Just explaining to them, or putting everything that the doctors say in a simpler term, and having someone trust me to care for their loved one is probably the most rewarding part. And just helping people in general. So working in the ICU as a new grad was extremely difficult, but I love my job. For right now, I don't seem to want to switch it. Again, if a COVID related video, or being a new grad working in COVID, is something that you guys are interested in hearing about or watching about, leave it in the comment section down below. I think the majority of the questions that I asked, that were asking me about, were just like an update on how it's going now in the ICU. So if there's any other specific questions that maybe you guys have that I didn't answer, put them in the comment section down below. I do go individually by each comment, and I do answer everyone's comment. I did get a lot of views on my ICU interview questions, and I would love if you guys could help me maybe get to 1,000 followers with this video. That would be absolutely amazing. I would love to keep on making content this year. As a new nurse working with COVID, and it was so hard to juggle my time with getting into the field, and getting into the field was during such a difficult time. So I honestly didn't have time to do anything. But now that everything is getting more normal, or that COVID has now become something that we have to live with. It's becoming now part of our regular schedule, so it's easier for me to now go ahead and make content for you guys, and I would love to continue to do that. So if there's any specific videos that you guys want to see, go ahead and put it in the comment section down below. Again, please go ahead and help me try and get to 1,000 subscribers. That would be absolutely amazing. And thank you so much guys for watching, and I'll see you guys in my next video. Bye.